Hello, my name is Kimberly Williams. I am the Behavioral Health Care Manager here at Children's Health Andrews Institute. I am a licensed clinical social worker. Today, I'm going to be presenting on mental health issues in adolescent athletes and share with you some of what I see in my practice here. Common mental health issues with athletes. Some of the primary mental health issues we see: anxiety, depression, NSSI, which is non-suicidal self-injury, disordered eating or eating disorders, secondary ADHD, obsessive compulsive disorder or OCD, and post-traumatic stress disorder. So athletes have unique mental health challenges for multiple reasons. It looks different in athletes, and I'm going to talk a little bit about why that is and what to look for, how to identify, and how to intervene. Some of the unique mental health challenges with athletes are that they experience stressors that their non-athlete peers experience, such as rigorous training schedules and balancing academic performance with expectations that are put on them by themselves, parents, coaches. Adolescent athletes experience the same things as non-athlete peers: the anxiety, the depression, suicidal ideation, ADHD, eating disorders, and substance abuse. Physical injuries, overtraining, concussion, sleep disorders, and social identity are some of the factors that also impact the mental health of adolescent student athletes. Physical injuries is what I see a lot of in my practice. Typically, patients are referred to me, athletes in particular, once they get a physical injury and they're taken out of their sport. When these athletes are taken out of their sport because of a physical injury and not by choice, they often are thrown into loss of identity. It can cause them to have depressive symptoms such as feeling hopeless, might start to withdraw from friends that they usually would spend time with and enjoy being around, often because they're not training with their student peers, they're not able to compete, and they lose a sense of who they are when they're taken out of their sport because of injury. So injury is something to look out for in these athletes, to watch and observe how they respond emotionally. Overtraining, of course, burnout. When athletes overtrain and become burnt out, they often can feel more of the stressors around them that are not tied to the sport, such as academic performance, might look like irritability, having bigger reactions emotionally than they typically would. Concussion is another one that it has a big impact on mental health. Typically, the symptoms of a concussion really lead to a lot of anxiety and depression, as well as feeding into difficulty with sleep. We see a lot of student athletes that have difficulty sleeping for lots of reasons, but it is exasperated when they're injured, or they have a concussion, or they're overtraining, they're overly tired, they're overly stimulated. And then, of course, social identity. So who am I socially? Who am I outside of my sport? And that comes into question when they're pulled out of their sport for injury, or if they do have a mental health diagnosis, it makes finding their identity that much more difficult. It's challenging to be self-aware when you are experiencing some of these symptoms and challenges that they do. So why do athletes avoid seeking help for mental health issues? This is a hot topic for me because we find that athletes typically have the mentality of, I can handle this on my own. I can take care of this. I don't need to tell anybody. Asking for help is often perceived as a sign of weakness. Negative past experiences. So maybe they've spoken up before about being anxious or feeling down and had a response that was not supportive. Worried about others' perceptions. So what will that look like for me as an athlete if I am expressing that I'm feeling this way Will a coach or a teammate or a parent translate that to how I will perform in my sport? That fear of what others will think impacts an athlete's choice to speak up and ask for help. Of course, denial of the problem, avoidance, turning away from the feelings, lack of knowledge. So just lack of understanding of what it is that I'm feeling, where the feelings are coming from. What do I do with these feelings when I feel them? Who's the best person to tell? Who's the best person to talk to? And of course, the stigma around mental health issues, which exists. It's starting to get better. I believe professional athletes are speaking up about their mental health challenges and how their mental health challenges have propelled them in their own sport and in their own personal lives. And as an athlete and as a human, it's getting better. So signs of mental health challenges, lots of signs to look for. So withdrawal or avoidance of activities previously enjoyed. So if you see an athlete who once would have fun and practice and joke around with friends and stay after, that starts to stop, or you just find that they're not as joyful as they once were, that's something to keep an eye on. So changes in sleep, again, I spoke about this earlier. If you're noticing fatigue, appearing tired, low energy, that irritability when an athlete is without enough sleep and they're still having to put their body at optimal functioning, there's going to be some irritability. There's going to be some signs of a breakdown emotionally. And a lot of it comes from lack of sleep and letting the body recover. Excessive worrying. So the thoughts that feel like they can't stop, bounce thought to thought to thought. Constant, feels like the thoughts control you. You're not in control of your thoughts. Those are some signs. Appetite changes. It's pretty prevalent in athletes. So weight loss or weight gain, noticing that and ruling out any sort of physical component, and then noticing and asking and wondering, is this something to do with the mental health component? Decline in academic performance, change in how the student is performing in the classroom, noticing if they are having breakdowns after they don't perform how they thought they should academically. Teachers noticing that they're not able to get their work done. They're not performing on exams like they used to. An uncharacteristic emotional outburst, again, coming back to that. Irritability, anger outbursts, crying. Those are the same things to look for. Anxiety signs and causes. Start with anxiety. So nearly 1 in 3 adolescents meet criteria for an anxiety disorder. Of those, half started to experience their anxiety at age 6. So anxiety is a very large umbrella, and underneath this umbrella are panic disorders and phobias and several different specific diagnoses, but generalized anxiety disorder is what we typically see in an athlete if they have anxiety. That's where it will fall under. So some of the signs of anxiety include feeling apprehensive, feeling powerless. This one's very important, the feeling powerless over your own thoughts. Your thoughts have power over you, and that causes more of those physical symptoms, the racing heart, breathing rapidly, sweating, kind of trembling, feeling weak or tired. That sense of danger is coming, catastrophe, everything is worst case scenario. Every outcome is what if, not living in the present moment, future oriented, what's going to happen next. A lot of it stems from feeling like they need to be in control. It is important also to note that there is a difference between anxiety and nerves. So nerves with athletes, very normal, very typical, often feels like adrenaline. There is a little bit of a physical component with the racing heart. However, nerves typically go away after an event. Nerves are typically tied to a competition, a meet, a game. some chance for the athlete to perform, and anxiety feels constant, almost as though you can't stop it, you can't control it. It often is not tied to a specific event. There is a big difference between the two. So that awareness and education is important for these athletes, these adolescent athletes, to understand. Because I think what happens with anxiety or worrying or nerves is once they feel that and they don't know what that is or what it's linked to or what's triggering them, it's going to make them feel more anxious if they don't understand where it's coming from. So taking some time, sit down with the athlete, get a sense of what their awareness is of their anxiety or of the symptoms that they're experiencing. Again, that anxiety has a pretty big physical component. So they're going to have some obvious symptoms that are going to trigger them to say, okay, something's going on, something doesn't feel right. So anxiety, what does it feel like when you are an athlete? This image right here, I think, is pretty powerful. So the chains being chained to that sport, that identity that you are in it as an athlete. So insecurities, am I enough? 100% perfectionism, relationships, deadlines, stress, having to be number one, scores, fear, anxiety risk factors. So which athletes are at more risk to have anxiety? So athletes with a history of sports injury, again, coming back to that injury, it's very important to make that connection. An injured athlete is at higher risk for anxiety. They feel anxious about return to sport. They feel anxious about getting injured again. They feel anxious about not being as good as they were when they went out. They feel anxious about what they're missing out on. There's a high risk of ADHD, high level of fear of failure, a significantly higher likelihood of being diagnosed with an anxiety disorder. So these are the things to be aware of in one's history. High levels of mental toughness and satisfaction are protective factors for athletes. So what I mean by this is oftentimes these athletes have mental strength, perceived mental toughness, and it can be reinforced when they are successful or they feel like they perform at their best, and it protects them from the anxiety getting identified and treated. Interventions for anxiety. So what do we do when we have an athlete who has identified as being anxious or worrying? So to best help someone with an anxiety disorder, it's recommended to know the emotional construct of the anxiety. Again, where is this coming from? When was the first time that you felt this way? Do you remember? Where were you? Who were you with? How long has this been going on? When you feel anxious, are there things that you've tried to do to make it go away? What has worked for you in the past? What has made you feel successful when you are anxious to get back in control of your thoughts, your feelings, your reactions? Once you understand the core of where the anxiety is coming from, for the most part, sometimes we're not going to always know, but once you have an idea of what's triggering this emotional response and these symptoms, then you can start to come into some of the more basic treatments and interventions and make some referrals and get this student athlete some more help. Anxiety does have a unique set of properties that sets it aside from other mental health disorders and other emotions too. For athletes, the thoughts and feelings that induce anxiety tend to be about the future. Just talked about this in the previous slide. Very future focused. Where is this going for me as an athlete? What's my career going to be? Is this what I want to do for the foreseeable future? Typically tied to, again, what they can't control. And when a student athlete feels like they cannot control something that's going to happen in the future, that's when a lot of this excessive worrying, repetitive thoughts start to kick in. The future element causing anxiety for the individual is typically typically a perceived threat or danger. So again, that future element, if they can't control it and they don't know and they can't lean in to controlling what they can control, they will feel threatened. They will feel like there could be danger. And that's when they go to the worst case scenario and the what ifs. Anxiety has a cognitive and physiological elements too. Again, that physical aspect of it. It's cognitive, there's physical symptoms, all the things to look for in these kiddos. So depression, signs and causes. So the next most prevalent mental health challenge and diagnoses that we see among our athletes. So signs, again, that poor performance, feeling fatigued, illness, so getting sick, injury. I will continue to mention injury throughout this presentation. Fail to recover from an injury in what an athlete perceives as being fast enough, quick enough. That is something to watch for when an athlete does get injured and they're on the path to recovery. There might be some roadblocks, there might be some hiccups that make it go a little bit longer. That change in treatment often throws these athletes into feeling hopeless, into feeling why bother. They start to have these thoughts that then they cling to and attach to, and it affects their emotional stance in everything that they do. Decreased interest in things that they normally would have fun doing, withdrawing, just being more quiet than usual, change in personality, again, that increased irritability, sleeping patterns. So in depression, you see both. You see sleeping too much or not sleeping enough. It can go either way. I think depression is often associated with sleeping a lot and sleeping too much, and that's true, but also watch for not being able to fall asleep and stay asleep. Changes in eating habits, problems concentrating, and substance use and abuse can all be considered depression signs in athletes. That substance use and abuse, we are seeing quite a bit of that too. Coping mechanisms, just poor coping with the emotional symptoms. Again, often when you're pulled out of your sport, when it's out of your control, typically from injury. So depression can occur for many reasons. It can be organic. Most commonly, it occurs as a reaction to a life event. Depression can be hereditary. Studies have shown that certain type of gene can be passed from parent to child, which does change the chemical serotonin levels in the brain. So the mood altering chemical that is thought to be lower in concentration in those who are at more risk of suffering with depression. Thought this was very interesting. This is a study by the NCAA depression prevalence. So prevalence of depressive symptoms by sport among 465 NCAA Division I athletes. So women in red, men in blue. So clinically relevant depressive symptoms, track and field demonstrated the highest prevalence of reported depression. I think there's quite a disparity too against males and females, as you can see. And I think the reason why that exists is oftentimes males are less often to report their depressive symptoms than females. So we've got soccer, softball, baseball, and lacrosse. Depression risk factors. Again, injury, involuntary career termination. So when you are forced out of your sport, and again, when you see your sport as your career, as your identity, and you are taken out when you are not ready because of injury, it puts you at a very high risk for depression. Overtraining, that burnout, all potential risk factors for depression and anxiety. So be on the lookout for these factors, watch these athletes closely, talk to them, check in with them on the recovery process when they do, if and when they do get injured, check in with them. I hear often in my practice, coach doesn't even know I exist anymore. I got injured and it's like I'm not even on the team. It's very common. I hear that very often. They no longer feel like they have a place, that they don't belong. So depression is very prevalent in injured athletes. So interventions for depression, the best course of treatment is a combination of medication and therapy. I think it's most important to start with therapy if an athlete has not done therapy before. It's always good to start with some interventions that can lead to the athlete feeling more empowered, more knowledgeable. I always say, kind of rule of thumb, try for about 4 months of therapy before getting on a medication, unless the symptoms are so severe in the depression that they can't even participate in therapy. So you're going to see this where sometimes athletes are so depressed that they don't have the motivation to do the work that it takes in therapy. The combination may vary with medication and therapy. All depends on the severity, like I said, the severity of the depression, how long they've been experiencing symptoms, what intervention they've already tried that has not worked for them. Again, the combination of the two has been seen in studies to be most successful for treatment. Antidepressants take anywhere from 2 to 4, even sometimes 6 weeks from when they are first taken to kick in and work. This is really important to take note of. So many times our athletes want to feel better right away, especially if they've made the decision with their family to go on a medication. Oftentimes that's hard enough just to make that leap. Then they want to feel better right away. And it takes at least, I would say at least 4 weeks to get the medication into the system to where you notice a change. This is tricky because oftentimes we see these athletes start the medication, they don't have that instant satisfaction, gratification, and they stop the medication. This is something that you need to talk to your medical doctor about. When you do go on a medication, make sure the athlete is taking it as prescribed. If an athlete is having side effects to the antidepressant that are unpleasant, talk to your doctor about those side effects. You don't ever want to stop an antidepressant without slowly weaning off. You don't ever want to stop an antidepressant without talking to your medical doctor. And you want to at least give it until 4 to 6 weeks before saying, this is not going to work. This is just not helping me. The most commonly prescribed form of antidepressants are SSRIs. These are used in most cases of moderate to severe depression. You will have heard of these medications. These are the Zoloft, Prozac, Celexa. These are the first line treatment of medication for depression. They work by increasing the level of serotonin and the neurotransmitters in the brain. But again, won't notice a difference until about that 4-week point. And then the difference might just be very slight. You might almost just think, I don't feel anything, or I don't feel that much different. Or you start to notice your symptoms less, and that's when you know the medication is silently working. So the next topic I want to talk about is self-harm. This is a big one too. So non-suicidal self-injury signs and causes. I'm going to refer to it as NSSI. So NSSI is not to be taken lightly. Oftentimes I hear parents and coaches say it's attention-seeking behavior. They're trying to get your attention for a reason. There is a reason why these adolescents are harming themselves. Even if it's superficial cuts and you don't think that it's serious, it is to be taken very seriously. So non-suicidal self-injury can be defined as directly and intentionally inflicting damage to one's own body tissue without the intention of suicide and not consistent with cultural expectations or norms. So this is important. Typically when we see adolescent athletes who are engaging in NSSI cutting behaviors or self-harm behaviors, they typically are not intending to kill themselves. It is not necessarily that they are suicidal. It does not necessarily mean that they have suicidal ideation. What it means is they are trying to inflict physical harm so that they can feel the physical pain and soften and quiet the emotional disturbances that they have going on in their head, the thoughts and the feelings. They then take control in the way that they feel that they can, and they cut. NSSI manifests in a variety of different forms. It's not just cutting, it's also skin carving. You see a lot of burning, a lot of burns. Scratching, punching or hitting walls, banging your head against the wall, inflicting a concussion, bone breaking, biting, pinching, interfering with wound healing. Cutting is the most common. That's what you're going to see the most of. Typically, you're going to see the cutting on the wrists. It's the typical spot where these adolescents are going after. They can typically hide it with bracelets. They can hide it under their watch. They can put a little Band-Aid there. You can wear long sleeves. Also, the other spot that we see cutting in most commonly is the upper thighs, where again, it can be covered even though you're wearing your little track shorts or your volleyball shorts, you can still cover the cutting. And then sometimes you're going to see these athletes who don't try to hide it. And you're going to see it very obviously, and it's going to be very evident that something's going on. We see both. We see some kind of shame and maybe some guilt in what they've done, and they want to keep doing it because they think that it works. Those are the athletes that we need to keep an eye on, where they are reinforcing self-harm because it actually feels like it's working for them to forget the way that they feel and to stop the thoughts and get control. NSSI can be associated with an array of somatic as well as psychiatric health symptoms and diagnoses, and even superficial injury may result in severe, serious medical complications. So oftentimes these kids try to do superficial cuts and they end up needing stitches, and they end up in the emergency room needing further medical care. Risk factors for NSSI. So prior psychiatric diagnoses, low health literacy, adverse childhood experiences. Bullying is a big one. Bullying, kids who have been bullied are at much higher risk for self-injury. Sometimes the mentality is, I deserve this pain. There is something wrong with me. They start to believe what the bully is telling them or saying to them. They then hurt themselves. You need this. You earned this. This is your fault. Again, problem behaviors. Female gender. Females are at higher risk for engaging in NSSI. Physical symptoms appear to be also a risk factor for NSSI as well. So interventions for NSSI, not too different from interventions of depression and anxiety. Again, it's maybe getting on an SSRI medication. Therapy, so cognitive behavioral therapy, CBT, DBT. The therapy in this instance for NSSI can be extremely helpful, mostly in adapting healthy coping skills, in identifying the emotion, identifying the thoughts, making the connection between the two, stopping the behavior of cutting, and using coping skills that are healthy, that are productive, asking for help, engaging with your peers, getting out with family, listening to music, art, coping skills, the list can go on, and it's whatever works for that individual. But until they know what works for them and what helps them feel better, oftentimes they're going to come back to the cutting because they know that in that moment they did feel better. So it's breaking up that pattern. And again, sometimes with NSSI, there could be a more severe underlying mental health diagnosis that has not been uncovered. And there might be a need for a different type of medication, an atypical antipsychotic to stabilize the mood so that the athlete can then participate and engage appropriately in therapy, in group therapy. So the next very common diagnoses, mental health concern that we see in our athletes, disordered eating. I'm calling it disordered eating and not eating disorders because disordered eating, again, like anxiety, is a large umbrella, and underneath disordered eating falls the typical, what you think of, anorexia, bulimia. The Diagnostic Statistical Manual for Mental Health Diagnoses has recently changed what eating disorders looks like by means of getting diagnosed. There are several more categories that have been added. It's very interesting. It's not often that you're going to see an athlete fall very cleanly into one box, such as anorexia nervosa. We're not seeing that as often anymore. And that's why it's almost more of a spectrum of disordered eating, and they've expanded the diagnostic criteria for getting diagnosed with an actual eating disorder. So disordered eating is common among student athletes due to a desire to be stronger. So watch for a change in eating habits, of course, restricting food, skipping meals. Most behaviors will occur within the student athlete's home. So it's not going to be very easy to spot when they're training, when they're doing physical therapy, when they're working with their athletic trainers. It's going to be tricky for you to know that this is going on. So oftentimes it's happening in the home. It's very secretive behaviors. There's a lot of guilt and shame associated around disordered eating. Disordered eating is another attempt for someone to feel in control. Disordered eating, I believe, and studies have shown, is often a symptom of something else going on. So there might already be underlying anxiety and depression that feels too hard to manage. And like the NSSI, restricting your food intake, skipping meals, engaging in those behaviors, you often see a result, positive or negative, that then reinforces that this is working for me. I don't need to feel this way. I don't need to sit with my thoughts. I'm going to take my control and put it around my body and put it around what I put in my mouth. So again, tricky to identify outside of the home, but extremely important to have conversations if you notice a rapid change in weight, or when you are all eating out together, if there's an athlete that's skipping a meal, moving food around their plate, drinking a ton of liquids, water, leaving the table after a meal, all things to keep an eye on. A lot of things too that you can see with athletes in the weight room, especially when they're in front of mirrors, is a lot of body checking. So they'll do body checking. You'll see these behaviors on their hands. They'll kind of grab their stomach. They'll kind of pinch to see that is one of the easiest ways to spot something's going on with how they view their body in a weight room setting that's outside of the home. Disordered eating may develop when a belief that success is tied to the student athlete's size and shape. This is so important. So when an athlete believes that they can be successful based off of their size and their shape, then that athlete is going to do whatever they can to be that size and that shape, no matter what. So being on the lookout for that. There are sports that are at higher risk for this than others, and I'm going to get to that here in a second. But again, that connection of success to your body is a very key component to be aware of. Also, let's not forget that athletes are constantly comparing themselves to others, and they're constantly being compared to others. They are being scored against others. They are being timed against others. So if they see somebody as perceived success or better than them, they're going to look at that person's body. What are they doing differently than I'm doing? We train together. What does their body look like? Well, maybe my body needs to look like that to be able to be better than them. So that comparison, tying success to body, is the highest risk for start of an eating disorder. Disordered eating may be rooted in student athletes' inherent need to compare themselves to their teammates or competitors, like I said, and further tied to physical appearance being connected to any type of success in their sport. If disordered eating goes unrecognized and untreated, it can lead to bigger problems in the future. Serious health risks are at stake. It can lead to a premature end in an athletic career and even death. These athletes can only manage and sustain restricting food and skipping meals for so long until their physical body does actually give up on them. And at that point, it can be too late. Keeping an eye on these signs and symptoms. So what are the risk factors for disordered eating? So family history of disordered eating, pre-existing depression or anxiety, obsessive compulsive disorder, a belief that weight is a determining factor in success, issues with your self-esteem already. You already don't know who you are, what your value is, what your worth is. Seeking that validation from others outside of you puts you at a risk for disordered eating, because you then tie it back to, what do I look like? What does my body look like? What do people think of my body? How does my body as a vessel translate to success as an athlete? Lack of self-confidence, a coach or a parent who puts success on an important level and mismanaged expectations to where that athlete feels as though they have to get into high gear and change something. And this is what they feel they can control. They jump into restricting, skipping meals, things like that. So sports that may be at higher risk for student athletes to experiencing disordered eating include swimming and diving. Again, we're in bathing suits, gymnastics, running, dancing, wrestling, and bodybuilding. Seasons of disordered eating can occur in all sports if it believes that it will help with performance. Disordered eating may be more common in female student athletes. However, we are seeing an increase in males that are experiencing disordered eating. The sports, again, rowing, wrestling, bodybuilding, and running, they're all equally affected, those sports with males. So a 2016 study of Division I college coaches that think eating disorders are a problem in athletics. It's interesting, number 4. Coaches who noticed dietary restrictions. It's getting a little bit higher there. Coaches who noticed negative body talk. You're not going to hear as much negative body talk. You're going to see more of the behaviors, less of it being talked about. And again, more of that like hiding, shame, guilt. This is a big one. This 4th bullet point, coaches who notice training outside of practice. Over exercising, over training. That is considered under disordered eating a compensatory method of purging. So when you think of purging, you automatically go to the vomiting, taking laxatives, abusing laxatives. This is going to be very common with athletes because they can use their body to lose weight, to gain strength by doing their sport. So not only are they trying to change their body, but they think that overtraining will get them there faster and get them and make them better at what they do. Big misconception, but it is a method and a form of purging. So maybe they can't restrict meals because they've burned this many calories and their body absolutely needs the food. So they might eat the food, but then compensate and purge by overtraining, overexercising, and doing so outside of practice and outside of the facilities, and doing it more at home. So coaches don't see it. So athletic trainers and physical therapists aren't aware. So be on the look for overtraining, overexercising, going for runs, long walks after a meal. Same thing as purging in a way that would be associated with bulimia. It just looks different in these athletes. Interventions for disordered eatings. Athletes with disordered eating rarely report their symptoms. This is a mental health diagnosis that is done in the privacy of their own body. They do not share it. They don't talk about it. They often don't want help because, again, when they notice results and they have a successful competition, they are making the connection and reinforcing the behaviors that what I'm doing to my body is working for me. So they're not going to tell anybody what they're doing. They're not going to ask for help because they think that it is working. They tend to deny the condition and are often resistant to referral and treatment. This is absolutely true, and it cannot be said enough. With disordered eating, these athletes need to be ready to make a change. They need to want to get better. Nobody is going to be able to intervene and help them if they don't want to be there. It is very similar with substance use and abuse in treatment and intervention. The person needs to have some level of motivation to get better, or it just won't work until they're ready. Screenings and interventions must be handled skillfully by knowledgeable professionals to obtain desired outcomes. So if there is suspicion of disordered eating, make sure the student athlete is seeing a professional. So often I hear thrown around, I think I've got an eating disorder, I'm anorexic. It's very harmful to just lightly and casually throw these terms around. These athletes need to be seen by highly skilled professionals who specialize in treating disordered eating. Certified athletic trainers have the capacity and responsibility to play active roles as integral team members of the healthcare team. So again, athletic trainers and physical therapists who are around these student athletes have an opportunity to see and catch some of these symptoms that often would go unnoticed. And it is okay to speak up and ask, what's going on? How can I help you? I notice you're looking a little tired. You seem fatigued. Did you eat today? No. How can I help? Can I get you a bar? Can we get a smoothie? Just starting to have light conversations like that, and then taking it to the next level and getting this student athlete the help that they need. They're frequent. So athletic trainers, physical therapists, frequent daily interactions with athletes help to facilitate the level of medical necessity for these kids. And oftentimes these athletes will open up to their athletic trainers. I find that they build that trust and that rapport and will disclose, hey, this is what's going on. I think this is why I keep getting injured. They often do reach a point where they can't do it anymore on their own, and they are going to ask for help. And athletic trainers are in a really awesome position to be able to be there and to help get them what they need. Helpful interventions for mental health changes. So if you think an athlete has a shift, turn, big change, consider seeking professional help as an option when the change in behavior persists for about 2 weeks or longer. You want to be really careful not to kind of just jump ahead of it. You want to be cognizant of how long the athlete has been experiencing these symptoms. That's where that awareness comes in, right? So getting an understanding of their perception of what they're feeling, how long it's been going on, when it first started, what were the triggers, what led you to this point of needing intervention and treatment. I'm going to repeat this because I think it's very important. What we're looking for here, withdrawing. This is big. We're in a very social time in this world. If you see a student athlete who is withdrawing from things and events and dinners that they normally would be at, enjoying themselves, having fun, something is probably going on. There's a reason why they're pulling back and wanting to be alone. So avoiding those social interactions, increased irritability. So that change in their overall mood and how they respond to coaches, to teammates, to teachers. What happens is with anxiety and depression, those thoughts and those feelings can feel so overwhelming, and the thoughts can be so loud that the athlete, the kid, gets completely bogged down in it, and they don't have the bandwidth to respond in a way that they typically would. So they have little anger outbursts, or they snap at mom, they snap at little sister. Look for those if that's not a typical response that you would see from the student athlete. Changes in appetite, again. And let's be clear on this, just because you notice a change in appetite in the student athlete Does not mean that we necessarily just jump to disordered eating. Does not mean that this athlete has an eating disorder. So be cognizant of what that change in appetite looks like. Changes in sleep, talked about that quite a bit today, and academic performance. Reframe therapy. Oftentimes athletes are like, I'm not going to go to therapy. I don't want to talk to a counselor. Therapy is not about fixing problems. Sometimes it is, but more often than not, therapy should be seen as a tool to empower yourself to get control over your thoughts, to reframe the negative automatic thoughts, to then trigger a different emotional response that is helpful for me and will eventually make me more successful all throughout life. So you're learning tools, skills that will help you on and off the field. It translates into life. It's not directly related to solving a problem or that you are broken and you need to be fixed. So reframing what therapy is. This approach, if athletes start to get help and they start to notice that it works for them, it will carry them throughout all areas of their life. And they will have a positive therapeutic experience that might end. And then later in life, they might say, hey, like, I remember feeling this way when I was an athlete, student athlete. I know that there's help for me. It's worked for me before. I'm going to go back. I'm going to get help. I'm going to see what else I can do now at this point in my life. Helpful tips for parents and coaches. So be aware of the expectations the student athlete has set for themselves. This is really important. I want you to have these conversations with these athletes, understand what their long-term goals are, have them talk about them, write down their goals, write down their expectations so that you have an idea of where this athlete's mindset is and what their driving force is. Where is this sport taking them in their mind? Knowing this, you will then be able to make more sense of some of these signs and symptoms that you might be seeing in this student athlete. Be sensitive to the student athlete's goals and desired outcomes. So lead with motivation and positivity. So even if that student goal or desired outcome doesn't seem probable for them from a coach's perspective or even a parent's perspective, lead with positivity, motivate them, just help them alongside them to get to the goal that they want. It's not our job to say that's an unrealistic expectation. It is our job to say, I think that's great. How can I help you get there? Or why don't we set some sub goals to reach along the way before we get to the end goal? So encourage without flooding. So I really would say in encouraging a student athlete, if they're going through a hard time or you're noticing these changes in their behavior and their mood, to not ask a lot of questions. So avoid the, well, why? And well, when did this start? And how come? And who? Is it my fault? Just slow down, take a few deep breaths, sit with the student athlete. Next point, create a safe space where feelings can be processed. Oftentimes, I think athletes struggle with putting their feelings into words out loud. So that might look differently for each student athlete when they sit down and actually start to talk about what they're feeling. And again, keep in mind, these student athletes have probably been feeling this way for a long time when they reach the point of asking for help. They've been trying to solve their own problems. So when they start to talk about it, listen with the intent for them to feel heard, not with the intent for you to respond. They may not be looking for a solution. They may just want to feel heard. Oftentimes when they start to talk about it, it automatically lifts a large weight off of their shoulders and they feel lighter, and then they'll come back and they'll trust that process with you. Awareness is the key to identifying and responding quickly with early interventions for student athletes who may need help. So an awareness comes on all fronts: an awareness within from the student athlete, an awareness as a parent, an awareness as their coach. Being aware of how you respond, how you behave, is going to be key in getting these student athletes the best help that they need. and taking ownership for, well, hang on, what am I doing as a parent that is not facilitating success for my child? Or as a coach, what I might have said a little bit differently that would have been motivating. Being self-aware, first step. Ask questions like, what do you need from me today to feel successful? That question is very powerful. It allows these athletes to feel heard, validated, and believed in. Parents, coaches, teammates, athletic trainers, teachers, and school nurses all have a responsibility to educate themselves and be prepared to respond. Thank you very much. That is all that I have for you today. If you have any questions, please do not hesitate to reach out to me. My email address is listed here, and I look forward to hearing from you. Bye-bye.